Assalamu alaikum everyone, and welcome to another episode of the Chai Chat. I am your host Dawood Jafree. I'm also joined by my colleagues and co-hosts Mahdi and Kazim on the show today. Say salam everyone.
Assalamu alaikum everyone.
Alaikum wa rahmatullah.
Looking forward to another one.
Nice. Before I start, if you guys have not subscribed, go hit that subscribe button right now. It takes 2 seconds and it will be really helpful for us. So make sure you like, share, and subscribe to the video and the channel, and spread it amongst all your friends and family as well. So that would be very helpful. So
and leave your comments. Leave any comments, positive and or negative. More positives if you don't mind.
Any ideas that you have as well? You know, if you have any suggestions, what you want to see, just put it down, send it to us, and then we'll inshallah be able to bring it forward.
Yeah, inshallah. So now let me introduce our special guest today. Today we're going to have a conversation around physiotherapy and physios and their role within the community, within the society as a whole. And for that, we have one of the coolest guys from our community, the Silverback Physio, aka Laraeb, with us today. Assalamu alaikum, Laraeb.
Alaikum assalam wa rahmatullah. Thank you so much, guys, for having me on your podcast today. I was really excited as soon as I was invited. I've been looking at all your podcasts online, so thank you for having me.
No, thank you for coming. Yeah, you're welcome. Laraeb, so just before we kick off, bro, give us a bit of an overview about your work, what you do, what is a physiotherapist? Most people don't know, because within our communities, it's very rare to find an Asian guy that's a physiotherapist. I've never been to a physio and seen an Asian around. So please feel free to enlighten us.
I can't imagine the conversation going to your mum and dad and saying, "Dad, I want to massage people."
Well, that's the misconception, right?
See, that's the stereotype we have.
Exactly.
No, that's a brilliant question, to be fair. And the common misconception still is that physiotherapy revolves itself around massages and things like this. However, the profession of physiotherapy concerns itself primarily with movement. So it's all about optimization of movement. It's about getting people mobile. And the key thing that we specialize in is rehabilitation. So rehabilitation, whether that's after a sports injury or whether that's to do with elderly age and to do with arthritis and conditions that are just part of the aging process, whether it's back pain, which is a national problem right now, whether it's in any kind of setting, any kind of subsection within physiotherapy. There's so many more subdivisions and there's so many more specialities you can go into, and we can go into them a little bit further if there is interest. My own speciality is MSK, so that means musculoskeletal, and that is a specialization around any injuries that revolve bones, ligaments, tendons, soft tissues, muscles. Basically, it's in the word MSK. The other specialities that there is like one called neuro, for example. That's everything related to the brain and rehabilitation after a stroke, or for a person that has Parkinson's disease, MS. You've got another specialty called respiratory, which we'll definitely talk about a little bit later because it's really relevant to the pandemic that's going on at the minute. But I hope that's an overview. I would say the main thing that we concern ourselves is rehabilitation. So we don't administer any drugs or anything like this. Our assessments are biomechanical. We are assessing people's joints and their movement and their strength, their balance. We're taking into account anatomy, pathology, injuries, age, all these different factors to come up with a holistic assessment to then try to also address things like lifestyle, which it's again, the profession, to be honest, has seen a shift in the recent years because of what Kazim said rightly. Is previously it was just thought of as the person that you go to that just gives you a bit of a massage. There's been loads of research done since, and over the last 10, 15, 20 years, we found out that any treatment that's hands-on, like massage or acupuncture and cupping, and again, subjects that we'll go into a little bit later on, they give you some benefit, but they don't necessarily address your lifestyle and they don't give you long-term benefits. So the idea of physiotherapy is to try to holistically improve the quality of your life. Okay, I know I've waffled on a little bit there, but I wanted to give you like a good, good overview of the profession.
Well, that's good actually, because in my field, we have to refer a lot of people to physiotherapy for back pains and things like that. And the most common misconception that my patients, when they come back to me, they're like, oh, we went to the physiotherapist, they didn't do much. They just gave me a paper of exercises to do, and that's it. And then we're always in this conversation of trying to explain to the patients that, you know, it's not a free massage that we're sending you to physio, it's about lifestyle. It's about teaching you the certain exercises or certain movements that will help strengthen your muscles, that will make you feel better. So it's good that you got into that actually.
I'm guessing it must be like a program that you kind of set up, a timetable or something that you set up with the patient, and you kind of follow on along with them, because it's not going to be a one-time thing. You'll make sure that they are, like you said, rehabilitated. So it's a long process, right?
Yeah, totally. And what you said there is really key, because when you go see a physio, the program or the treatment that you offer should be tailored to you based on the assessment of you as a person, your age, your activity levels in general, your profession and what job you do. Taking all of that into consideration, we should be able to come up with something for you, okay? If you go see a physio and he just pulls out something which is generic, that might be appropriate in some cases, might be appropriate when it's something, a generalized problem that's really, really common that we see all the time. So we might give you a generalized bit of advice that helps 99% of people. But it's a red flag also if a physio is doing that repeatedly and repeatedly and repeatedly, they're not really doing their job. It should be tailor-made. It should be specific to you. And you should have this goal-setting conversation with the person that you're seeing and ask those questions to the physio. So for Kazim, it would be like, these patients that are coming to you and saying this, they should also be saying it hopefully to the physiotherapist as well, because we're trying to create, like, it's teamwork, you know, you've got to work together with the patient. It shouldn't just be a one-way process.
So how much of your job actually involves, like, you know, the sports physiotherapists like we see on TV or in sports shows where players get injured and then they have a physiotherapy giving them a good massage to relieve the inflammation? How much of your job is actually to do with that anymore?
At the minute, within the NHS, very, very little, because the majority of work that I do is I'm full-time employed by the NHS, and that Monday to Friday, 8 till 4, I'm doing that less than 10% of the times. You know, it's really, really uncommon, and it would have to be really appropriate for that patient, because now what the risk is nowadays, a lot of people are coming with chronic problems, which means the problem has not been there for a few weeks. They've had this for months and months and just sat on this injury or sat on this problem. So now if you do any kind of hands-on treatment, like a massage that feels great, they're going to become dependent on this. They're going to think, oh, every time I have a massage, I feel a bit better. So they're going to keep coming back. And in a private setting, because I work privately as well, you can exploit this. And again, this is where I want to make people aware. If you're seeing somebody and he's saying, you need to come and see me every single week for a massage, it's another red flag. You know, you don't want to be in a situation where you become somebody's cash cow. And when I personally see people in my private setting, there is a lot more flexibility and leeway with hands-on treatment, because we'll have athletes coming to us or people that have had this treatment for years and are really well aware of that. We're aware that the problem is not chronic. We're aware that they need to have some hands-on treatment because of the stress that they're putting their body through, because they are athletes. So with that population group, which is 1% of the population, it's really appropriate. Got an athlete, I'll do something hands-on. I'll put some needles in and do acupuncture. I'll do cupping therapy. I'll give them a sports massage if they need it. But with anyone that isn't pushing their body to that limit, they're probably not going to have a great deal of benefit.
And just before we actually go into some of the treatments, how did you get into it as a person yourself? Were you always interested? Because the way we get introduced to physio is through football and team sports and injuries, right? How did you get into it? What did you do to look into what a physiotherapist does? So if there's people watching, maybe they can take the same pathway and not make some of the mistakes that you maybe made previously as well whilst you were getting into things.
Okay. So the route that I took to actually get into the profession is a really traditional one of going to school, college, and then uni without any breaks in between. Where my interest came from is a couple of things. One thing was I was dead set that I did not want a job that involved sitting down in front of a desk or in front of a computer screen, because it just didn't. I knew that's not something that was going to work for my personality, and I knew I wanted to not go into work every single day dragging myself into work. I wanted to do something where I'm going to go and I'm actually going to enjoy myself, and it's going to be something that I enjoy.
Just explain my life story. These right there.
Yeah.
Honestly, that's my job.
And it's something that we see every single day. This is a question that we ask as part of our assessment. What do you do for a living? How much sitting does that involve? Because it's just a trend that we're seeing. People that sit a lot there's a very specific set of problems that comes with sitting too much. And there was even a campaign a number of years ago that said sitting is the new smoking. Okay, a little bit of scaremongering, and it doesn't really have scientific evidence behind it, but it was just a way of trying to highlight the problem with sitting. But yeah, so the major thing for me was being active in my job, and the second thing was just a fascination with human movement and human anatomy and the biomechanics between how joints move and how muscles move, and that was obviously from watching sports, looking at movements and having a fascination with each sport. I wasn't drawn to one specific sport where I thought, I love watching football or I love watching boxing. It was the fact that people were able to do so many varied things with the anatomy, with their given anatomy, and with skills and with training. They were all able to do such different things. So that the fascination was very much with biomechanical movement, if you like.
And
is
so
is this something you got interested in like through PE lessons or something when you were in high school? Or
no, PE was a DOS. I don't even, PE was just us playing and messing around, really. There was never an academic mindset whilst I was doing PE where I was thinking, oh, this is something I want to do long term. At my school age,
all the PE teachers are going to hate you, bro.
Yeah, that's it.
No, having said that,
but we know it's true. We know it's true. One of my best lessons were PE because all we did was play footy.
Yeah, you just mess about.
We were meant to try all these different sports. We were meant to try racket sports and the whole lot. All we did was play football all day, every day for 5 years.
Do you want to name and shame your PE teacher, mate?
Forget that. The funny thing is, I wasn't good at football at the time.
So yeah, sorry, Laraeb, go on.
Some people out there might still say I'm not good at football, but I beg to differ.
Laraeb, I'm actually interested. So when you were studying, I'm guessing there must have been a lot of practical activities and stuff and training whilst you're studying at university. So coming from a Muslim background, obviously kind of touching and especially when it comes to the opposite gender, so having to touch another female or a female having to touch a male, there's always a bit of a problem there. Did you have to kind of work your way around that maybe when you were studying or even now in your actual professional career?
Well, how do you know that, Mahdi, how do you know that wasn't one of his motivations to go into it?
Well, we can find out right now.
We can find out right now, Lorraine.
Like Kazim has exposed me. I've got nowhere to hide.
Oh God. No, I'm sure that it was for whole clinical need of patients.
Yeah. So it's an interesting question. It's a good one as well. The religious aspect was a factor that I didn't take it into consideration until I actually, it was probably too late. I'd signed up to do the course. I knew that there was a lot of physical elements to the course. But I didn't realize how much interaction there would be between the different genders. I contacted sort of local scholars and scholars that I could online as well. Obviously, depending on the Maraja you follow, you can ask them on their advice. And the advice that I was giving personally was to try to cover my hands, to try to use gloves when we're doing palpations.
No, but jokes aside, Laraeb, like I was obviously joking around with the motivation. Obviously, I know you're a very nice guy. It's interesting to know because you see, like in my field, it involves a lot of touching of the opposite gender, and we coming from the Muslim sect, there is sort of like issues when it comes to that. But in our field, where its clinical need outweighs the sort of like the harms of it, the scholars allow us to do that. But even within our field, like, so for example, if I chose to do something that would involve more touching the opposite gender, it's recommended that I don't go there unless there is obviously a clinical need. Let's say there's no I don't know, obstetrician and gynecologists in a whole city, then it would fall on me to go down that route. I'd be interested to know, as you said, it was already too late for you, but there might be kids there watching who might be interested in this, and they want to know what is the scholarly opinion on this topic of going into it, and is there a choice where you can go into it and not necessarily be involved in touching the opposite gender too much?
Okay, so yes, it's absolutely. If you contact the university before you start the course, I know of people that have done this as Muslim girls that are considering the profession and have presented their religious beliefs and said, how are you able to accommodate this? They have been able to accommodate it in most circumstances. There is a couple of institutions that might say, not sure what we can do about that, because it's just is going to be part of your profession. You're not going to be able to have a choice eventually when you're actually qualified, and the patient that presents themselves in front of you, and you know, it's very unlikely that you'll get a choice then. But at the university stage, you're often grouped with a group of people that you do practicals on with each other. You might do assessments on each other. You might show them parts of your body, and you know, that works vice versa, where you're practicing on each other in palpation and assessments and movements and all of these things. And you can just sort of make sure that you surround yourself with the same gender. And this is a really, really simple and easy way to get past it.
The thing is, there's definitely a big need for this. Like, for example, just the prevalence of back pain in Muslim women, for example, or even Muslim men, and now even younger people. It's just so prevalent. There's definitely a need, and you know, like, certain women will only come to me, whether they're Muslim or traditional Christians or Jewish, or even if they have a personal preference. It's not necessarily a religion thing. It just might be a personal preference thing. I get a lot of non-religious people who say, I just want to see a certain type of gender doctor, and you know, there's no harm in that.
More comfortable. You know?
Yeah, exactly. It makes you feel more comfortable. So there definitely is a need for this. So, you know, before making the decision, I know that universities are accommodating for that. But just from the Muslim, because we're all Muslims here, just from the Muslim point of view, what is the scholarly opinion on this? Are you aware of that? Or
the scholarly opinion on
before choosing to do physiotherapy?
I don't know.
Okay.
I don't know, because I've not been in that situation myself. I've really looked into what if you were considering the profession.
Yeah,
and
that's what I mean.
That's what you're asking, isn't it? If the barriers are in front of you. But like I said, I do know Muslim girls that have decided to go into the profession and have made those sort of arrangements where they've said, before I start the course, can I just ensure that these are my religious beliefs and it can be accommodated for? Does that answer your question?
I mean, Kazim, what were the suggestions made to you, you know, before you were going to study medicine? Because I'm sure it's the same thing.
Yeah, so this is the thing now. Just thinking about from what I do know of the Islamic understanding and this profession, because again, as I said, there is definitely like a clinical need for this. You know, the prevalence of musculoskeletal problems, the prevalence of, for example, stroke. People have stroke, they need physio. That's the mainstay of treatment after a stroke. You need physios to get people back on their feet as much as they can. So there's definitely a clinical need for that. Whereas, like, personally, when I was becoming a doctor, obviously you are allowed to train and touch the opposite gender, with some scholars saying with gloves, etc., and for examination and even intimate examinations as part of your training. But as I said, when it came to like a choice, like for example, I could go into, for example, being an eye surgeon or a heart surgeon or a urologist or a obstetrician and gynecologist, which in the latter two involves a certain, obviously more prevalence of a certain gender. I think at that time it was that, let's say, for example, you come from a city or a rural area where there is no obstetrician and gynecologist in mind, for example, I'm a guy, then you should be okay. But if there are already people in that field, in the sense that there's plenty of obstetrician and gynecologists, then I should choose a sort of a career path which isn't so much involving the opposite gender. But it's not like a red line. It's not like a taboo that, you know, you can't examine females. Like I have to, and actually as part of my job, and I have no problem with doing examinations, whether intimate or not, in order to diagnose patients. But that's my job.
Yeah,
So would it not be transferable?
I think you're right. That's what I was going to go down the route of. Like, if any kids are watching, obviously you have to look at your scholarly opinion. By that we mean who's the taqleed that you're doing. Is very important to do taqleed on these issues, because you can't just use your own common sense on it. Otherwise you'll be, you know, accountable for that judgment that you make. So it's always good to get expert advice on this and refer to your marja that you feel is the most knowledgeable on the topic, and follow what they say. But yeah, I mean, I don't see why it would not be transferable, if I'll be honest. And I think you would probably find that that is the case.
I think the majority of the scholars that we have, especially in this day and age, man, I think everyone has a realization of the fact that, look, people living in the West, sometimes they may not have a choice during their training or even afterwards, working for the NHS, for example, where you.
But Jafree, I don't think it's just a West thing. Like, you know, I've been to Iraq so many times. I'm from Pakistan, and you got plenty of like in my own field, you got plenty in Pakistan. Actually, you have more female doctors in medical school than you have male doctors. You know. Yeah. So it's not just a Western thing. I think it's just
no. I'm saying from a scholarly perspective, I think they're aware of the situations that
exactly.
can occur, and they've made accommodations for these situations to be able to be accommodated within the realm of Islam and within the scholarly discussions. You can see that quite easily. But I want to take the discussion back onto Laraeb. So you mentioned so many different types of physios, and you yourself are currently working within the NHS. What are you doing on a day-to-day basis, especially nowadays? We're I'm sure people will know, because we're still doing these virtual podcasts, that we're still around in times of quarantine and self-isolation. So within the NHS, physios are becoming increasingly more important now, especially with coronavirus and the treatment that is being offered on the NHS to patients that are presenting with coronavirus to the hospitals. Yeah, I believe so.
Does a coronavirus patient need a physiotherapist? Because
that's exactly
entry, isn't it? I mean,
yeah.
Hopefully you can.
It's a great point that you've just brought up. So, what is my role within the NHS? So I started at the beginning by saying that I'm an MSK physio, and we concern ourselves with joints and bones and injuries of that nature. And had you asked me pre-lockdown, that's what I was doing on a day-to-day basis. I was going in, I had referrals from doctors like Kazim and surgeons that had done surgery and patients that had trauma. And I would see between 15 and 20 cases per day, some of which are completely brand new patients that I've never seen before, some patients that I'm doing ongoing rehabilitation with on an appointment basis. So that's what an average day would have looked like for me pre-lockdown. Face-to-face interaction, a very, very lengthy and thorough assessments of patients to figure out exactly what's going on, followed by like a rehabilitation program. But over the last couple of weeks, that's flipped completely upside down. Okay, so since the lockdown, obviously, no more face-to-face appointments. So within a course of a few days, we had to ring all the patients on our caseload and just make them aware of the situation, that the ongoing treatment that we've been doing face-to-face, don't come into the hospital anymore, with all the social distancing and stuff like that, which I don't think there's a need to go into it because you went into it in your previous podcast. Since then, the part of the COVID emergency response is to have retrained all the MSK physios to work on intensive care. So that's not just happening at my hospital, it's also happening in Salford and London and all across. So we had somebody come to us who is an anaesthetist, and he's the lead anaesthetist across the Northern Care Alliance, which is my employer where I work. And they look after a number of hospitals in this area, basically in the Greater Manchester area. What they're doing is they're using, what he said to us is, what we want to do is use your MSK expertise, which is joint mobilization and movement. And we want to use that as a transferable skill and bring it into the intensive care unit. Now, Mahdi asked a really good question of what why would you need a physio if you've got a chest problem? So there's different specialities, and one speciality is respiratory physio, which concerns itself with cardiovascular function and lungs. So after patients have, for example, a heart attack, or if they've had some kind of respiratory problem, even chest infections, physiotherapies use a number of breathing exercises and techniques to try to clear their lungs. Now, with a COVID patient, and I'm not an expert on viruses and how they behave, so Kazim can correct me on anything that I say that's not accurate. What we've been taught and trained in is that when somebody becomes critically ill, when somebody is bound for ICU, the intensive care unit, usually the criteria for this is obviously that they usually have some form of organ failure, okay? And with COVID patients, this is your lungs, right? So they're filled with pneumonia, okay, which is leading to collapsing of the lungs. So imagine something that's normally very elastic and expands, full of air, oxygen, reduces, no longer has the ability to expand inside your rib cage and then come back down to its original size, because the lungs are just collapsing with this pneumonia because of mucus plugs, because of the lack of air that people are able to breathe in. So there's just that lack of elasticity because of all these, these gunky lungs. Now, there's two ways that this person is treated on the intensive care unit, a sort of a multidisciplinary approach. One person, the most important person, is the anesthetist or the intensive care doctor, which is in charge of the ventilation tube that goes inside your mouth and is filling it with a certain amount of oxygen. So they determine what percentage of oxygen there should be going in and the pressure of air that's going in, okay? You've got to imagine like a balloon that's normally elastic. You're filling it with air, it expands, and then as the air comes out, it comes down again. That doesn't really happen when you've got a lung where the lobes of the lungs are collapsing in different places. What you have to start doing is actually manipulating the position of the lung in order to give it some space inside the rib cage so it can actually expand. So this is where we come in. We are the repositioning team now, okay? So every 4 hours, a patient that's critically ill, they're not able to move, so the function of the lungs is already significantly reduced. So imagine somebody that has got no ability to move their own limbs and move their own body. And I've got various attachments in their, all across their body as well. So they've got obviously the tube going inside the mouth. They've got arterial lines. They've got catheters. They've got foot pulses. They've got ECGs. They've got so many attachments. So in order to move this one patient to reposition his lungs, just to maybe just give him a side angle or get him slightly in a different position so the lungs can actually expand, it needs 4 to 5 people just to do that job because of the amount of attachments that's there. So we've now been broken up into smaller teams of physios who will pair up with one of the intensive care doctors to be able to do these maneuvers every 4 hours to allow the lungs to expand and relax. And because that's not good, that really natural process that we take for granted that happens every day without us even thinking about it, no longer happens with these we're talking like critical. So that's why I said my life has been flipped upside down, or my work life, is because I'm used to interacting with my patients, speaking to them, asking them how their day was. And now I'm dealing with patients that can't even make eye contact. They can't even lift a finger, So it's a dramatic change, but our skills are really well suited. These are called transferable skills, because in order to actually qualify to be a physio, you have to train in the core areas. You have to train in neurology, and you have to train in respiratory, and you have to go onto the wards before you can decide, oh, I'm going to specialize in this area, similar to what doctors do. So yeah, your question was quite a loaded question. What are you doing on a day-to-day basis? But I just wanted to give you an idea of what it would be like normally, and hopefully it'll go back to normality eventually, and what the emergency responses and how my day-to-day is looking like at the moment.
Yeah, now I want to try and understand. So it's really interesting that you mentioned that it's the repositioning of the lungs. How do you do that from the outside in? Because I'm touching myself and I don't see how I can get through the rib cage or be able to position my lung in some sort of a way. How do you do it?
Okay, again, really good questions. And because I'm into what I do, I don't mind explaining it into as much detail as you'd like. So keep the good questions going, guys. Really good. So in order to do what you said, trying to do it yourself is completely impossible. For example, one really, really common thing is that what patients don't know is when one of the first things people do when they have a chest infection, they go on bed rest and they don't move. And the first thing that get told when they come into hospital is sit up, get moving, because just that little bit of movement of, even if it's a little bit of movement of just going from a horizontal angle to a vertical angle, is going to allow perfusion of oxygen and air to move into different lobes of the lungs and just have a mechanical effect. So in order to do it, you need a really, really deep understanding of what is the anatomy under your skin. How is the rib cage positioned? Where's the heart positioned? Where are the lungs positioned in relation to your rib cage? Because when we take a patient that's lying on their back and then we're laying on their front, most people don't know there's way more space when you're actually laying on your front for your lungs to expand. So we're trying to take advantage of positioning, so biomechanics and gravity. Okay, so we're going back to basics, no technology, although obviously all the attachments and everything is, they're administering certain drugs to keep people's heart rate stable, and we're just making sure that, you know, they're on some level of painkillers and pain relief as well, and keeping them sedated, really, really important as well, as keeping them at that level. So there is some level of drug management, but that's not healing the person. That the thing that's actually going to allow them to recover from these severe pneumonias is giving the lung its best chance to rehabilitate itself by giving it its best chance to allow it to expand and allowed to relax. So we're getting lots of air in, and we're getting lots of movement of the lungs. Because if the anaesthetist has got a tube in his mouth and the position is in the same position, the position is of the patient is the same and the position of the tube is the same for 24 hours, you're probably not going to see any changes, because that lung has not got the capacity to expand to begin with. So you're just blowing air into nothing. We need to just be able to manipulate the position a little bit. The best way to explain this to you, though, is to imagine a ball, like a football, okay? And imagine you've taken all the air out, and you know how it collapses, yeah? And then imagine you turn that ball a little bit, and then the other part starts collapsing. And then you're doing that, but you're doing that in a really systematic way to ensure that all sides of the ball are eventually getting a chance to expand. Does that make any sense at all, or do it sound like that?
I didn't know anything about it at the start, so that's really helpful. Thank you.
I mean, like you said before, you know, because we don't really think about how we can get deep inside and actually figure out what's going on inside. You know, we just take it all for granted. So the very fact that you can actually look at someone and say, okay, if you turn this way a little bit, you'll be able to breathe in a little bit more, and then, you know, a few more hours later, turn this way. And you know, the fact that you've actually figured out these different movements or these different kind of geometries of a certain person can actually help them with their breathing or whatever it may be, is actually really, really amazing.
I just wanted to say at this time that, you know, how much even as a clinician and also just a general member of the public, we appreciate like the work that you are doing as a physiotherapist, especially to patients who right now are basically in between life and death, and how important it is and how much of a big sacrifice it is that you guys are making, you know, that you are literally right on the front line. I mean, talk about front line, you're at literally, you know, even worse off to the front line, because you're right in the enemy's mouth, because you're literally there in ICU, where it's the deepest of deep safety problems and everything. So, you know, thank you for the work that you're doing, and it's awesome. But I don't know whether you guys want to continue talking about COVID. I know that's all we seem to be talking about
right?
this time. It's getting a bit, getting people down a bit. And let's just bring it a bit more. I just wanted to ask, I'm just genuinely interested. You know, I see a lot of people, friends, family, patients, right, who have a lot of back pain due to sports or bad posture and things like that. I don't know whether you guys experience back pain. I know in a certain equations I have. What would you advise for back pain to prevent getting back pain? What do you think? What would you advise?
Okay, so there is not a day that normally goes by where I don't see a patient that hasn't got back pain. So I was saying earlier, I see about 15 to 20 patients per day on average, and at least one of them, it's usually a lot more than that. And the statistics say it's somewhere between 60 to 80% of the population will eventually, at some point in their life, experience some level of back pain, whether it's mild, moderate, severe, whatever. So it's something that we have done loads of research on. There's loads of studies on this, and we're really well equipped to deal with back pain. The problem is it usually comes down to lifestyle. So, for example, there's been a number of studies now being done that have taken a bunch of people that complain of back pain, and let's give them different treatments and compare which one works best. Let's take one group and give them lots of acupuncture. Let's take one treatment and let's give them lots of massage. Let's do one group and get them to swim every day. And let's take one group and get yoga, Pilates. Everything has been researched to death. And there's a little bit of improvement we found with the passive movements. So anything that you receive from somebody else often tends to give you a benefit, like for a little bit. But as far as all the exercise related treatments are involved, they all benefited. So what they found in the conclusion of most of these studies was there isn't one exercise that is going to get you better. It's essentially about getting moving. So to really simplify the point is the trend that we see of people with back pain, it doesn't tend to be a fit person.
Let me tell you something really funny, right? Well, you might not find it funny, but I say this to a lot of my patients, right? Especially a certain cohort of elderly patients. And they come to me and they say, "Oh, son, you have no idea how much I move around. Do you think it's easy to wash clothes and cook food and do the chores around the house?" And I say, "I'm very active at home." Obviously, they don't go to the gym and things like that. So what do you say to them? Because in their head, they are not living that sedentary, sitting on a chair lifestyle, but they do have the back pain.
You must face a lot of patients that are stubborn as well. So, you probably telling them, you need to get moving, you need to go out and actually go for a walk 20 minutes every day. And, they just say, no, I don't want to do that. You must face a lot of patients like that as well.
Yeah, absolutely. This is a completely different whole topic that we talk about, which is chronic pain, which is people that have usually had this problem quite persistently, and also behavior change. So this is, again, we're touching on lifestyle issues here. All the time this happens where people say, actually, I'm a mother of so many, chasing after my kids, I'm doing the cooking, then I'm doing the cleaning. So that's all the exercise that I'm getting. What we often do, it's really, really hard to tell a patient what to do, right? Usually 9 times out of 10, if you tell a person what to do, they're not going to listen to you. And just because of preconceived beliefs that they might have, or, because they haven't seen the results. I've done the exercise you asked me to do for 2 days. I'm still no better. They're expecting a quick fix like this, usually a magic wand as well. So usually a really safe place to start so that you don't fall out with the patient is to say, did you know what the government guidelines are in regards to exercise, and what is the established consensus amongst health professionals, the people that, like I said, researched this to death? And then they'll say either yes or no. Usually it's no. And then you'll say, did you know it's 150 minutes of moderate to vigorous exercise, or 30 minutes per day? And then they'll say, well, yeah, no, I'll probably get that. And then I'll say, and if they are getting that, then I'll say, well, do you get yourself, when you're doing the dishes, are you getting out of breath? Okay. When you're doing certain tasks, is it actually challenge you to your physical capacity to a level where you're having to concentrate on what you're doing? So for example, if you're actually going for a walk that's a bit vigorous and a little bit paceful, you actually have to think about what you're doing. Otherwise you're going to lose your balance, and otherwise you're going to lose your focus. And that's where the actual benefit comes from. It comes from the hormonal changes and the changes that you get, firstly to your heart, to your lungs, getting all the oxygen in, and then this release of endorphins. And that is where that pain relief is coming from. Okay, it's the endorphin release that, and it's often a bit of a dopamine hit that you get in your brain that makes it enjoyable. Okay, because there is a reward attached to it, and it's an internal feeling that's built into our DNA. And you can get really, really deep into this. Hopefully, by this point, the patient accepts the research. If it's somebody like you, and I have to go into a bit more detail, then I might. We might start explaining the anatomy to that patient and actually showing them a model of a spine or a knee or a hip and say, look, this is what it looks like. If you move it, it stays nice and lubricated and it stays strong and it stays flexible. When you don't move it, this is what it looks like. And then we might show them a really, really stiff one or an arthritic one, just to give them a comparison of what the benefits of those exercises are. Yeah, I can go into a bit more detail. But
no, that's very good. Just as a quick disclaimer for all the viewers out there, strictly speaking from the professional point of view, whenever you do have back pain, we do recommend that you do see a medical practitioner, because back pain can sometimes be a very serious illness. And there are certain emergency situations where back pain shouldn't be just put down to lifestyle or other things, even though that might have caused it. So if you do suffer with back pain, please do book an appointment with your GP, and the GP or your doctor will recommend certain treatments for you based on your clinical need. So please, any viewer out there, don't take symptoms lightly. Don't need to stress too much, but do always get medical advice.
Thanks for that GP plug, Kazim.
Have to do it.
I
have to.
just want to bring it back to a point that Laraeb just made. So you were talking about how you know, some of your patients, they would say, I'm a mother of 4 children, so yeah, that's my daily exercise. Now for them, they are used to that, and that's their life now. So they are used to running around after their kids and, you know, cooking dinner and doing this and that. So eventually your body just kind of gets used to it. So again, that doesn't really become exercise anymore. That's just your life. For me, for example, you know, 24-year-old, no kids, nothing to kind of run after. If I were to put in that lifestyle, maybe, yeah, for the first week or two, that would probably count as exercise, because I'm doing something different and my body's having to get used to it. But once you reach to a stage where it's your daily kind of thing, it's not exercise anymore, is it?
Yeah, absolutely. So you've answered the question there for those patients that come with those reasons or those excuses that actually I am pretty active. I don't get a minute to myself. And at that point, you are thinking, well, what you're doing right now is just your routine. It's not your exercise. It's just something your body's got conditioned to. So therefore, it's not going to have the effect of increased heart rate, increased oxygen to your body, all the benefits of exercise, and there's just too many to talk about. You're not going to gain those benefits because your brain is not perceiving that as exercise. It's just perceiving that as I'm doing my daily chores.
Nice. So I want to move the discussion on a little bit. And you obviously talked about your work with the NHS, and that's your full-time job. But at the same time, you also do private work on the side as the Silverback Physio. And on your Instagram and stuff, we see a lot of times you post stuff about maybe some of the private work that you're doing with UFC fighters or MMA fighters in particular. How'd you get into that? What, as in terms of the MMA fighters, what type of injuries do you see with those guys, man? They must come to you with some serious
Jafree,
messed up.
have you ever
bodies.
seen an MMA fight? Are you seriously asking
Yes.
what type of injuries you get with an MMA fight?
No, for like what injuries would you go to a physio for versus what you'd go to a doctor for? Yeah.
Mate, I'm sending them all to him.
So ideally, the first point of contact you should have, if you're a little bit unsure about what you've done, is like Kazim said earlier, is to go speak to your GP. And your GP is that gateway that should be saying, oh, this sounds serious, let's get you investigated and let's do some scans. Or actually, it sounds like this sounds like a musculoskeletal issue, let's send you to a musculoskeletal expert, which is what we are, and we then try to go to that rehabilitation route. What are the common injuries that you see with MMA fighters? You see a lot of bad necks because they spend so much time in headlocks. They spend a hell of a lot of time rolling and spinning over their necks. So you're seeing a lot of shoulder dislocations, shoulder injuries, and tears within the ligaments inside the shoulder, a lot of more upper body stuff. You get the occasional broken jaw as well. But most of the injuries tend to be sort of upper limb injuries. Having said that, MMA is brutal. I've seen probably every sports injury you can think of as far as MMA is concerned. Your other question was, how did I get into it in the first place? And the best place, if you are already a physio or thinking of going to into that profession where you'll get lots and lots of exposure to injuries, is rugby. Okay, so that was like my foot in the door. As soon as I qualified, I started volunteering at different sports clubs, mainly rugby clubs, because they don't tend to be as high profile as football clubs. There's a much better chance of you actually getting, not if you don't get a job, you'll at least get some work experience there, and loads of exposure. These guys are complete beasts. This is a situation, the first time where I've said to someone, you've got this injury. If I were you, I'd stop, and they'd go back onto the pitch and they'd carry on with their sport. That sport comes with a certain mentality, and that's when you're forced to just learn completely different skills, and these are called pitch line skills, and that's where your sports injury expertise come in a little bit. So my MSK job that I do is very much within the NHS, and the private work that I do with Silverback Physio is MSK, but it's also then the subdivision of usually sports injuries, people that are either professional or semi-professional athletes.
So are you watching some of these MMA fights and going, oh damn, that's the shoulder gone, oh damn, that's the neck over with, oh, do you get to enjoy these fights even?
Well, yeah, there is an enjoyment with it, and I don't know, it becomes such an automatic thing where you're looking at a certain movement or a sport and you're saying, yeah, this guy's just torn his ACL, or this guy's just done a subluxation of his shoulder or something like that, and you straight away, because you understand the mechanisms behind those joints, so you can already say, right, okay, that joint shouldn't have gone that far, it doesn't normally have the capacity to do this, he's definitely torn such and such a structure. So it happens with football, it happens when I watch MMA, but it even happens like when I'm walking on the street and I'm in the supermarket, when we're looking at person's walk, especially when I'm with colleagues, we spot the person with the knee replacement, and we spot the person with this, that, the other, and certain abnormalities in their gait, and it's a really geeky, nerdy thing to do, but people that enjoy it.
I also noticed on your Instagram, you do a lot of like cupping sessions and stuff as well. So can you just get a little bit into that and tell us, what are the benefits of cupping, and why exactly, or why would someone go and do cupping?
And also related to that, because there's two types of cupping, right? There's wet cupping and then there's dry cupping as well. And maybe just explain what the difference is between the two.
Okay, so the cupping therapy is something that has got, it's really popular at the moment, and a lot of athletes are getting into it, and a lot of this sort of sports massage industry and these industries are getting into it. But historically, it's a sunnah of our Prophet as well to do hijama. Okay, and it's considered a detoxification, and there's tradition and hadith to support that. Really, we're advised to do this practice in order to detox our system and our body. Pre-Islam, it was done in China, and the Chinese people did fire cupping or dry cupping. Okay, and in these with these cups, you just heat up the cup, and when you start burning the oxygen, it creates suction as soon as you place it on skin. Okay, so that cup is not going to go anywhere. If anything, is going to pull on the skin and create this effect like something is stuck on your skin and pulling on it. So the dry cupping side involves no actual penetration of the skin itself, which is basically the main difference between wet cupping and dry cupping. Is in wet cupping, you actually make little incisions on the skin and allow anything that's superficially not being circulated very well or has just accumulated itself in a specific area, you just remove it from that specific area. So the main benefit that people report after having treatment like this is just feeling lighter, feeling a little bit fresher, feeling like they have a little bit more mobility in those areas. So there's that religious aspect to it, or cultural aspect to it as well. And now there is totally there's a modern spin on it as well nowadays, with athletes doing it like Michael Phelps, Conor McGregor, Khabib. So all these people are now taking place in this practice, which is getting quite popular, I'd say.
Yeah, because I remember in the Olympics when all these swimmers used to come out and just take their tops off, and you see on their backs they've got these cup marks. I don't know whether it's wet cupping or dry cupping that they used to, and then it just blew up from there onwards, right? Michael Phelps had it, then all these other swimmers started doing it, and then all these other athletes started, and now I guess it's keeping you busy.
Yeah, absolutely. It's really, really popular. It's come to a point where I tell people that maybe in your case, you've had this problem for a few months. This is probably just going to give you relief for a little bit, and it's not going to be the end to treatment, because what people run away from is the rehab side, okay, which is where my real expertise lie, and which is what I'm really passionate about, is the rehabilitation aspect. And sometimes people think that just one session of cupping therapy or hijama is going to get rid of all the pain that they've experienced for many, many years. And what they don't sometimes maybe understand is, no, actually, I'm going to have to do something as well. I'm going to have to start looking after myself. I'm going to have to start moving around a little bit, maybe lose a little bit of weight. So I always just try to add that bit of disclaimer to when I offer those type of treatments, because for me, it's never been about growing my business or trying to popularize it and just become this tycoon of the industry. It's always been more about educating people and raising the profile and awareness of my profession.
Yeah, so that's a good point that you make, because obviously cupping, acupuncture, these types of therapies are homeopathic in therapies. Not they don't necessarily have a strong clinical background, so to speak. So how do you balance that with your clients and say, look, clearly there's some sort of an effect that it has on their body. It makes people feel better. It may change their mobility for a short period of time, but then they're in their minds, they're thinking, that's it. All I need to do is get cupping done every 2-3 weeks, and that's it. I'm sorted.
Yeah. So the way I sell all my passive treatments that are hands-on, because I like to keep it sort of evidence-based, because that's sort of ingrained into me with my NHS training, is that education is the very, very first thing that is on top of my treatment plan. So when I'm thinking of, right, this problem has got these problems, and this is what I'm thinking from a treatment perspective, the very first thing I've got to do is educate them and tell them, this is what I think your problem is. This is how I think we should address it. And part of that usually is when I'm offering them a treatment like cupping, I'll say, this is a window of opportunity. Okay, so you are going to get relief. It's very likely that you're going to feel a lot better after the treatment, because most people do. But just make sure that whilst you're having that window of opportunity, it doesn't guarantee that your pain is going to be gone forever. It could come back next week, and you're going to be messaging me again. It's going to be great for my business, because I can have you turn into a cash cow and come and see me every single week or every single month, and it's going to look great in my bank account, but it doesn't help you sleep at night. I'd rather tell you how it is.
Yeah, absolutely. Nice. And so one of the other things I wanted to touch on in this particular podcast as well. So these days, obviously everyone's I'm working from home. I've got a desk. I've got a bit of a chair. But before I had this, I got this literally a couple of days ago. But before I got this, I was slouched on the couch with my neck just like this, looking at my laptop screen. What sort of advice would you give people working from home on mobility, on posture
techniques?
Yeah,
and
exactly.
Give us a session now, whilst you've got.
Yeah. Do you want to do a session now?
Well, not a full-on session, no, because we'll link your Instagram, and people can DM you and
Dawood just got bad posture. He doesn't want to show you.
Yeah, I've got you're going to see the hunchback of Notre Dame right there. So yeah, but what sort of advice would you give these guys, and me in particular, on working from home and the mobility and posture side of things?
Okay. If it's not part of your habit to get moving every hour, and just getting that little bit of mobility and a little bit of movement into your joints, then even if it's just sitting, I'd compromise on someone just doing bits of sitting stretches that involve moving your neck into every direction. What we often say to people is little statements to make it stick in the head. So when it comes to sitting jobs, we usually say to people, in terms of mobility, if you don't use it, you lose it, right? Because it's easy to remember. So think of all the joints you have in your body, okay? Maybe starting with the neck, then the shoulder, and then your wrists, and use them. You don't necessarily have to do anything strenuous, even if it just means turning your neck into all the different directions, up, down, left, right, tilting into both directions. Just doing that, for a couple of cycles. You don't have to be stringent with your reps. You don't have to necessarily do it for time. As long as you're asking yourself, have I moved the joints that I have to their full capacity? Have I given my neck a good stretch? Have I done that the same with my shoulder? And that takes less than 5 minutes. It's a really, really quick thing. Most of us do it first thing in the morning when we give ourselves a really good stretch. Yeah, so it is ingrained into our DNA. There is no doubt that we do it, but we usually don't do it routinely enough because our lifestyles are just not allowing us to do it. 50 years ago, 100 years ago, it would have been completely different. You probably never need a mobility routine because the lifestyles were too demanding and you were forced to use your joint and your muscles to their full capacity. So that was their maintenance. Unfortunately, now the lifestyle isn't really giving you an incentive to do this. I'll sometimes say to a patient, imagine that you have a car, okay, that has 5 gears, but you only ever drive it in its first 2 gears, right? What's going to happen to the other 3? You're not going to eventually be able to use them. They're going to get rusty, right? So this is me saying, right, if God's given you a heart, make sure that every single day you make a point of raising your heart rate. Make sure you know about it. Make sure you remember that you have this organ inside your chest. Okay. And start just going through the list. There's going to be some parts of your body that are going to feel nice when you do those stretches because you've not done it in ages and it's been asking for it and craving for that movement. And there's some areas that you're going to stretch and it's not going to feel very nice. Okay. And that, again, that's your body saying, maybe you should do this a little bit more and get me used to it.
And what about when you're sat at a desk? Let's say you're working at a desk on your laptop, or even if you're, slouched down a little bit trying to write something. I wonder what's the best way to kind of sit there? What kind of chair should you have? All these little nitty gritties that will actually make someone feel a little bit
I'll be
better.
honest. So when I was looking to buy a chair, there's so many different types of chairs around. Ergonomic this, the tilt on the back can go so many degrees. Even when you're looking at a desk, there's desks that you can raise up now.
You're just thinking, I want to sit. I just want to sit.
I just want to sit down, man.
See, clearly we're dealing with the really deeply ingrained problems in behavior. Okay? So the problem here isn't as that simple. The ergonomic industry right now is making so much money off of people like you. Okay, what we need to do is we need to, number one, my treatment plan is to educate you, man. Yeah. So the first thing you need to understand is that this body that you have, that God's given you, has got so many bones, it's got too many joints. We're talking in the hundreds. Yeah. You wouldn't have done all this if it was just designed to sit there and look pretty like you guys. Yeah. It's there for a reason. So if your spine has got 33 vertebrae, they're not supposed to be sat in a chair like this with a perfectly arched curve with a little cushion behind your back, with all things that help if you are in pain. Yes, if you're in pain, then do these things, invest in ergonomics. But if you're a fit guy like you two guys talking to me, get moving.
Three guys.
Yeah, I mean, Kazim, I thought you know the national guidelines and all this.
There we go.
Yeah.
Fitness.
So look at this as if you want to maintain what God's given you, okay, you're gonna have to make some use of it, unfortunately. And it doesn't have to be timely, okay? It doesn't have to be a big time investment. In fact, the only thing that you really need is the little bit of mobility that you still have and that motivation to keep those joints moving.
So I think the advice here is, instead of trying to figure out the best way to sit, or whether it's a standing up table or whatever, the best advice is probably just leave that work, go for 15 minutes, do some movement, and then come back.
Yeah, and it doesn't even have to be 15 minutes. Like we encourage people every half an hour. You don't have to do loads. Yeah, like I said, even if you just go up and down the stairs just that one time, okay, and come back to where you came. Okay, that is enough for you to just not have to think about, am I sitting right? Is my posture good right now? Because that it's a whole another kind of worms where people become really, really self aware, and they're constantly thinking of their posture, and they're constantly thinking, maybe I should be like this, maybe my chair should be different, and then they're buying all sorts of mattresses, they're buying all sorts of cushions, they're buying all sorts of ergonomic equipment, and those braces that you guys might have seen, posture braces that keep you nice and upright and they keep you straight. All these things.
I was going to buy one of them.
Yeah,
I was going to buy one.
It's a really common question. People ask us about these things all the time, and I say, yeah, you can spend your money on there, or you can spend a little bit of time just moving, and you'll get the exact same benefit.
I know what Dawood would rather do. He's not spending time. He's spending.
Next episode, I want to see the brace.
You'll see it next episode. Yeah, definitely. Definitely. Yeah. So you mentioned another thing that I want to know about, and we'll probably use that as the last point, is mattresses. People, you see
Dawood,
that?
are you just going through all the equipment in your house and what are you going on?
I was looking to buy a mattress as well.
Looking to buy more, like you probably bought one of these mattresses, right?
No, I'm looking because
wasted your money
there's so many different types of these things, because people say, oh, you on the advert you'll see, okay, you're sleeping for 7-8 hours a day, so you want to make sure that the mattress that you have is orthopedic or has certain support or whatever else. Do you say, okay, that's
you've got a point. You spend most of your time, I think, a third of your life sleeping, right? So
what does that even mean? What does that even mean? That your mattress is orthopedic? What? It comes with a surgeon underneath the mattress. What does that even mean? That your mattress is orthopedic?
I don't know. It says it on the advert. So that's why I'm asking Laraeb, why is it that you need to have a firm mattress or a soft mattress? What's a recommended mattress, bro, that I should buy?
Recommended mattress.
So the word orthopedic in this context is just a selling point, right? In this context, orthopedic just sounds like this is something I need in my life. This is gonna do good things for me. Memory foam is another thing. Okay, like the foam has memory. It remembers who you are. It remembers your name, your date of birth, everything. And you know, it's usually far more simple, and people complicate it because we've got too much spare time. The spare time that we should be using moving, we're thinking about what mattresses we should be sleeping on, right?
Clickbait.
There are, of course, there is better quality mattresses, and they do make a difference, and people have preferences. Firmer mattresses are generally considered better for your spine and for your body, just because they give you more support. It's got nothing to do with any form of technology or any kind of special springs inside there that give you gentle massages while you're sleeping, and none of that. It's just, it comes down to comfort. And ironically, and what I found is that when I usually go to places like Pakistan or Iraq, I sleep a lot better there because there are just firmer surfaces usually that we're sleeping on in those countries. I don't know if it's to do with just being more tired as well because you're traveling. But testing mattresses is a good idea. A lot of mattress companies now offer that you can trial the mattress for either a week or 30 days and give it back. And it's all comes down to the quality of how refreshed you're feeling when you're waking up. You'll find lots of literature and diagrams on Instagram and people saying that there's certain positions that you should sleep on, you shouldn't sleep like this, and you shouldn't sleep like that. A lot of that is theoretical and doesn't have an actual evidence base. There isn't any studies where they've forced people to lay on their side and sleep in that position and then forced another group to sleep on a completely different position. Because realistically, you don't know what you're doing when you're sleeping. You're half dead. Okay, so yeah. A lot of the mechanisms of your joints and of your soft tissue becomes really irrelevant because actually you're in this deep state where sometimes this is why people can sleep when they're sitting, right? And people can sleep in this really awkward position because it's more related to your nervous system. Your sleep is a far deeper mechanism that's happening inside your brain and into your physiology all over, where your body's just getting this amazing recharge, physiologically speaking, that things like your joints and the position and the surface that you're sleeping in are not that relevant.
Interesting. So I think we're coming up to just over an hour now. And there's so much more to talk about. I think I need a lot more advice on a one-to-one session with the Silverback Physio.
Trying to save his money from Silverback Physio, trying to maximize Laraeb's time here.
Laraeb's thinking, this is the next guy I need to target right now.
I've already got it in my head. So let's have a one-to-one.
Yeah, no, nice. Well, thank you, bro. It's the Silverback Physio. Thank you for joining us on the podcast. We're going to have you back and talk a lot more about some of the other specific things that we only got to touch on a little bit. Hopefully next time we do it in person in our studio, and you can maybe show us some demonstrations as well next time. Thank you to Mahdi and Kazim as well, as always. Make sure that you guys watching go subscribe to the Chai Chat YouTube channel. Go like us on Facebook and Instagram. We're also going to link the Silverback Physio Instagram underneath in the description. Make sure you go like the page and sign up for all the notifications as well. So thank you very much for watching, and inshallah we'll see you soon with another episode.